So if you inject filler and it inadvertently goes into a blood vessel, what it does is it blocks off that circulation. It blocks off or limits that amount of blood going to the tissue that it was supplying. It's called necrosis. And this is where the skin ends up turning really black, falling off, and other complications can happen down the line. Now, one of the most feared ones is actually blindness. You could go blind from injecting filler, but typically in certain areas. So if you're injecting filler into blood vessels that either supply the eye or that can backflow into vessels that feed the eye, there could be an episode of blindness. Now, this is one of the most feared complications, and luckily it does not happen very commonly, but this is why you need to know where you're going, you need to know who's injecting you, and as an injector, you need to be able to stay away from these danger zones. For example, when injecting into the nose has a lot of blood vessels that surround it, and some of those blood vessels can lead back to the eye, which means the arteries supplying the eye. So if you're injecting an area in the nose or right above the nose, you can inject filler and inadvertently get it into a vessel that feeds the eye, leading to blindness. Usually this happens pretty quickly, so if a patient starts to experience symptoms such as blurry vision or a loss of vision, it happens pretty quickly when injecting, and you need to know the proper steps to take if it does happen. Now, there is no safe injection, but there are safer injection points, and so this is where experience really comes into play. If there's a really dangerous area, probably best not to treat that area. Maybe look at some other modalities to treat it or some safer ways to go about it. Lastly, if you do experience a filler occlusion, you need to know how to deal with it. Most established clinics have a protocol to deal with these emergencies if they were to happen, and by following them, there is a better risk of either reversing or improving these symptoms. If you have any questions, reach out to us at skinmdmichigan@gmail.com.